Hello everyone, and thank you for your interest in the 2021 Tuscarawas County Community Health Needs Assessment. My name is Gabby McKinnon, and I am the project manager of the Tusc County Health Needs Assessment, and I work for the Hospital Council of Northwest Ohio, just outside of Toledo, Ohio. If you started here to review the Tusc County youth data, I wanted to start off by mentioning there's an additional presentation posted to review the methodology of the Community Health Needs Assessment. For example, you will find information regarding the design, analysis of data, and response rates. Additionally, this presentation is only focusing on the youth population, which encompasses grades 7 through 12. Please check out the additional presentations to review the methodology and adult portions of the assessment. I wanted to take a minute and specifically talk about how the COVID-19 pandemic affected the process of this community health needs assessment. First, data collection for both the adult and youth surveys did take place during the COVID-19 pandemic in August through October of 2021. With the COVID-19 pandemic affecting the lives of Tuscarawas County residents, uneasiness grew around data collection. As mentioned in a previous slide, the total sample size was only 208 residents, resulting in a 6.78% confidence interval. The youth population had a total sample size of 699, with only 37.5% of Tuscarawas County's public school districts participating. During the youth data collection, there was an increase in the local COVID-19 cases, which ultimately impacted the total sample size. The following categories fall underneath the youth health portion of the assessment. I want to mention that the full Tusc County Community Health Needs Assessment is over 150 pages. We will only be touching on a fraction of each section to give you a general overview of what type of data you will find in the full health assessment. The first section we will be reviewing is weight status. We have information regarding body mass index, nutrition, and exercise. First, 27% of youth were classified as obese. 56% of youth participated in at least 60 minutes of exercise on 5 or more days in the past week, and 33% exercised every day. 10% of youth did not exercise any day in the past week. Twelve percent of youth ate 5 or more servings of fruits and vegetables per day in the past week, and 43% of youth drank a can, bottle, or glass of soda 1 to 3 times in the past week. The first graph you will see in this presentation is reporting out BMI classification. To explain the graph a bit, you will see the very first bar on the left as the 2021 total percentage. Then as you move to the right, you will see data broken down by gender and age. The lightest color on the bottom represents obesity, followed by overweight, normal weight, and underweight at the very top. Lastly, you will look at the bars on the right, and you will see old Tusc County health data from previous assessments. This is why it is important that we ask the same questions from year to year, so we can look at changes to the data throughout the years. We see the highest percentage of those who are obese being males at 32% and those 13 and younger at 30%. Here's a comparison table with comparisons starting in 2015 for Tusc County. Additionally, we incorporate the national and state level comparisons to be able to look at how Tusc County is doing in comparison to Ohio and national data. I wanted to point out that in 2015 and 2018, HCNO conducted the youth data collection process, which surveys 6th through 12th graders. For 2021, OES conducted the youth data collection process, and they survey 7th through 12th graders. Now we will be looking at tobacco use. 3% of all Tusc youth had smoked all or part of a cigarette within the past 30 days. 3% of youth were current smokers, which means having smoked at some time in the past 30 days. And 12% of youth had used an electronic vapor product in the past 30 days. Of those who obtained electronic vapor products, they reported obtaining them the following ways. Borrowing, bummed them from someone else, 78%. Bought them from a vape shop or a tobacco shop, 28%. Gave someone else money to buy them, 26%. Bought them in a convenience store, supermarket, discount store, gas station, or vape store, 8%. Bought them on the internet, 6%. Sold them from a store or person, 3%, and some other way at 42%. This slide is looking at the breakdown of youth who are current smokers. Here we see the Tusc current smoker rate is lower than both Ohio and US rates. Now we will be looking at alcohol consumption. Of all youth, 11% had their first drink of alcohol before the age of 13. 8% of youth had at least one drink of alcohol in the past 30 days. And based on all youth, 3% would be considered binge drinkers. Youth drinkers reported they got their alcohol from the following. Someone gave it to them at 45%, gave someone else money to buy it, 28%, a friend's parent gave it to them, 23%, a parent gave it to them, 20%, took it from a store or family member, 8%, bought it at a public event, 3%, and some other way at 50%. 7% of youth reported drinking on the weekends, and 1% of youth had driven in a car after they had been drinking alcohol in the past 30 days. Here we see the highest rate of current drinkers are those 17 and older at 25%. The current drinker and binge drinker rates are both under the Ohio and US rates. Now we'll be looking at drug use. 5% of youth had tried marijuana at least once in the past month. Among those who tried marijuana, 41% of those used marijuana in the past month. And youth reported using marijuana in the following ways. Smoked it in a joint, bong, pipe, or blunt at 52%, vaporized it at 40%, and some other way at 8%. Four percent of youth reported ever using prescription drugs. 2% of youth reporting using prescription pain medication, and youth reported using prescription drugs at the following times. After school at 43%, weekends 36%, and before school 21%. Tuscarawas County youth had tried the following in their life: hallucinogenic drugs, inhalants, and liquid THC, all at 2%, followed by ecstasy, MDMA, Molly, and synthetic marijuana at 1%, cocaine and steroids without a doctor's prescription under 1%. 7% of youth reported ever using over-the-counter medications to get high in their lifetime, and 4% of youth reported that someone had offered, sold, or had given them illegal drugs on school property. The highest percentage of youth who used marijuana in the past month were those 17 and older at 14%. All of the following in this table for 2021 were lower than the Ohio and U.S. rates. Now we are looking at mental health. 23% of youth reported being depressed. 14% of youth reported they had seriously considered attempting suicide in the past year. 6% of youth had attempted suicide in the past year. And among those who attempted suicide in the past year, 25% reported their suicide resulted in injury, poisoning, or overdose that had to be treated by a doctor or nurse. Tusc youth reported the following ways of dealing with stress. Physical activity at 45%. Avoid people who created drama at 39%. Express oneself through the arts and literature, 28%. Participate in hobbies or community service, 24%. Get support from others, 23%. Limit exposure to social media, 14%. And meditate, pray, or use relaxation techniques at 13%. The highest percentage of youth being depressed were those 17 and older at 38%, followed by females at 31%. Again, all of the percentages from 2021 were lower than the Ohio and U.S. rates. Next, we'll be looking at social determinants of health. 52% of youth had been to the doctor or nurse for a routine checkup in the past year. 62% of youth saw a dentist for a checkup less than a year ago. And 30% of youth got 8 or more hours of sleep on an average school night. %13 of youth reported they did not feel safe in their neighborhood. Youth reported they agreed or strongly agreed with the following statements about school. My parents pushed me to work hard in school, 77%. My parents talked to me about what I do in school, 65%. I can go to adults at my school for help if I need it, 58%. My school provides various opportunities to learn about and appreciate different cultures and ways of life, 51%. I feel like I belong at my school, 42%. And I enjoy coming to school, 30%. %12 of youth reported gambling in the past year. And youth reported they had experienced the following gambling situations in the past year. Gambled more than they had planned to, 31%. Felt bad about the amount they bet or about what happened when they bet on things, 21%. Hid from family or friends any betting slips, IOUs, lottery tickets, money, or things they won, or other signs of gambling, 7%. Next, we are looking at adverse childhood experiences, also known as ACEs. These are potentially traumatic experiences in a child's life that may lead to a negative health outcome later in life. The most reported adverse childhood experience was parents becoming separated or divorced at 40%. And 21% of youth had experienced 3 or more ACEs in their lifetime. The highest percentage of those who visited a dentist in the past year was females at 66%. There was a significant decrease in those who had visited a dentist and doctor in the past year from 2018. Now we will be looking at violence. 4% of youth were threatened or injured with a weapon on school property in the past year. 15% of youth had been involved in a physical fight in the past year. And the following types of bullying were reported. 22% were verbally bullied. 18% were indirectly bullied. 8% were physically bullied. 5% were cyberbullied. And 3% were sexually bullied. Being in a physical fight, threatened or injured on school property, and experienced dating violence was lower than Ohio and U.S. rates. The last section we will be looking at are perceptions. Here we are looking at perceived great risk of substance abuse, which includes drinking alcohol, smoking cigarettes, using electronic vapor products, smoking marijuana, and misusing prescription drugs. Here we are looking at perceived degree of great disapproval by parents, looking specifically at what parents would feel is very wrong. Similar to the previous slide, here is perceived degree of great disapproval by friends. Thank you so much for your time and interest in the results of the 2021 Tuscarawas County Community Health Needs Assessment. Please remember to review additional sections of this presentation that you may be interested in, including the adult sections. Before we finish, I also want to encourage you to fill out a participant feedback survey with more information on the next slide. Here you will see the link to our participant feedback survey, which is on the SurveyMonkey platform. We ask questions that will help the Healthy Tusc members move forward with planning for their community health improvement plan, which is the next step in this process. When community leaders consider the priority health needs for Tuscarawas County, it is helpful to use data from the above survey along with data from local organizations in the County Health Rankings report, since the most recent Community Health Needs Assessment report does not represent a complete picture of the health of county residents.